From suicidal thoughts to feelings of nervousness, we have a new insight into mental health issues that faces by students across our state. Thanks to the Healthy Youth Survey, a survey given every other year to 6th through 12th graders. Now across our state, it's bringing light to behavioral health risks and trends among our kids. And we're diving into the survey results all week long as back to school season ramps up, giving you a glimpse into what your child may experience when it comes to issues like violence, social media, and more.
And Frankie Thompson sat down with the Washington State Healthcare Authority talking about the most concerning trends that our state is seeing related to mental health, and this is what the state uncovered.
Joining us in studio from Washington State Healthcare Authority is Sarah Mariani. Sarah, we're talking about mental health trends revealed in the Healthy Youth Survey. So let's get right into those results here. So in general, how big of an issue is mental health according to those survey results?
Mental health is a significant issue that we need to attend to with the youth in our state as well as across the nation. When we look at the Healthy Youth Survey results, what we see is that while there have been some improvements with our youth, it's still a significant issue for us to address. For instance, 30% of our 10th graders are reporting depressive feelings, and 15% are contemplating suicide.
Wow. So when we're talking about the mental health issues, what were the top 3 issues and challenges that students were reporting?
Using the data, what we really look at are feelings of anxiousness and uncontrolled worrying, the ability to not stop worrying, or constant persistent anxiousness. Those are things that really come up a lot. And then when we look at suicide, contemplating suicide, making a plan for suicide, and tragically, those that are thinking or attempt suicide.
Yeah. When we're talking about those challenges specifically, how severe can those challenges escalate to? What's the risk there?
Well, the risk is high. What we see is that while about 30% are contemplating, about 15% make a plan, and then about half of that attempt suicide as we look across the grades of 8th, 10th, and 12th in this survey.
Wow. Is there a specific demographic that we're focusing on or that has peaked in this latest survey result?
We see that the trends generally across all ages apply. However, we do know there are some students that appear to have higher levels of risk. And when we look at students that have food insecurity, which means they may have skipped a meal, they may have had to cut a meal due to not having enough money for meals, or we look at housing insecurity, having to move a lot, not necessarily having a home that they can call their own, living with other people. Those are instances, those social and environmental factors can really take a toll on youth and their mental health.
On those lines, when we're talking about home life, how does the home impact a student's mental health?
Well, the good news is that the home can provide for good mental health. We know that when youth have an adult that they can turn to, that could be in the home, the school, in the community, when they have an adult that they can turn to when they're feeling depressed, when they're feeling stressed, it really makes a difference in their lives. And parents, caregivers, or any adults, if you're an aunt, if you're an uncle, maybe you're by blood or maybe not, any of those adults that can show care, concern for youth, it really makes a difference. We also know similarly some of those environmental factors or social factors that I mentioned earlier, food insecurity, housing insecurity, can also really be hard for kids to deal with. We also saw in the data that those students that struggle with disabilities, emotional or mobility disabilities, when they're not able to engage physically or with activities that are available, that can really be a challenge and can contribute to challenges with mental health.
Yeah, we know the Healthy Youth Survey is done annually. When we're looking at the latest results, is there any increase or decrease compared to prior years doing this research?
What we've seen is that there has been a significant decrease recently in the data. So when we look at the 21 data compared to the 2023 data, there is a decrease across the ages in challenges with mental health. However, it's still significant, and we're still very concerned when we look at these numbers overall.
Yeah, absolutely. So what ages? You mentioned 10th graders are really seeing a struggle. What specifically in that demographic, 10th graders, is the peak challenge? We mentioned anxiety. What are some other things that they're feeling in those challenges?
So when we look across the ages, we generally see similar statistics. 10th grade, however, is an interesting year because there's a lot of transition happening in that year. That particular age is an age where you've been in high school now, but you're coming of age. For 10th grade, and you think about what those new pressures and stressors are as you age, we do see that anxiety and feelings of worry do seem to grow as they get older.
Absolutely. We mentioned suicide earlier in our conversation, and that's always the ultimate risk when we're talking about mental health challenges. What are some signs that teachers, parents, other students can look out for to check on their peer?
If you are worried about somebody's mental health, if you're worried about them contemplating suicide, things that you can watch for are changes in patterns of their behavior. Are they more irritable? Are they having mood swings? Might they be getting in more fights or escalated emotions? Sleeping patterns changing or erratic sleep patterns? Eating patterns changing? Any of those type of things where you notice this seems like a shift that's happening with this person. Maybe they're isolating a little bit more. It's really good to check in and just say, how are you doing? Is there something I can do to help? And all of us can do that with anyone that we notice, including youth.
Well, there are several resources available if your student is struggling with their mental health, including the Trevor Project. We've linked the resources on our website at fox13seattle.com.